Hi, good morning everyone. My name is Shalini Fernandez. I am one of the candidate, I can say alumni of Edu Skills International, Father Salin Joseph. I am very privileged to be one of the team member, and 2022 I have moved to UK. Currently I am in Bristol working as a junior manager in the Department of Rheumatology, which is very exciting. As you all are enthusiastic and waiting, looking ahead for an opportunity to work in the UK, to be the fact now currently it is being freezed. However, don't worry, doors will be open to you very soon. Do your best, keep updating your skills and knowledge along with the communication skills, which is very, very essential to work in the UK. Dear friends, coming to the UK was really something new, I think 4 years ago, because the opening just opened and we were just rushing to fly to the UK. We are still valued. Our education has got a greatest value to work wherever we go. Being the part of EduSkills, I would say you are welcomed anytime, having the basic values, the basic ethics in life, and having spoken English as your first language wherever you go, it will be very, very interesting. Dear friends, I want to say something. You have got exciting two news to be given at the end of this video. Just wait for it because it is a suspense. I had joined the institution in 2020 where the COVID hit India and all around the world. I think we were given ample opportunity to share our talents into the group, into the world, and under the guidance of Father Salin Joseph. Today, at this moment, I would like to share some of the experiences that I had in the UK when I moved in first. Basically, I was a professor teaching in a reputed college in Mangalore, being with thousands of students, teaching different subjects, enjoying education for nursing students was my passion. But internally, I had a thriving for clinical skills where I wanted to give something to the people under my care. And I was destined to be here in the UK, and it is now 4 years going to be. When first I came to the UK, I had joined a ward which is called hepatology gastrology ward, where people are with hepatic disorders, and also we could see a lot of people with mental distress, because alcoholics, they turn to be very depressed at the end of the day. I worked with them and it was little challenging when we start to work, because for 15 years working as a professor in the college, having no direct touch with the patient unless and otherwise I had to teach students some of the clinical skills. It was very hard, but nothing is difficult if you really look for it, and if you want to thrive or you want to achieve something, you are determined to get something. Nothing is impossible, and that is what I felt in my life. Dear friends, coming to the UK was really something new, I think 4 years ago, because the opening just opened and we were just rushing to fly to the UK. And the day came where we were oversaturated with a lot of Indians working in different parts of the UK and different units. However, we are still valued. Our education has got a greatest value to work wherever we go. Being the part of EduSkills, I would say you are welcomed anytime, having the basic values, the basic ethics in life, and having spoken English as your first language wherever you go, it will be very, very interesting. Dear friends, I want to say something. You have got exciting two news to be given at the end of this video. Just wait for it because it is a suspense. I said I worked in the clinicals and I did my best, but I was looking for the ample opportunity to climb the ladder. That is what we are aspiring about. When we are in India, we say we want to go to abroad countries to have a career development, to have a career progression. It should not remain on the tip of the tongue, but it has to be put into practice. That's what I did. After 6 months, I gave an interview. I have given plenty of the interviews, where one interview where I got selected to be a practice educator, teaching the newly graduated nurses and also supporting the internationally graduated nurses like you and me. I enjoyed this job for 1 year, giving them the competencies signed off, giving them the support where they needed in the wards, and making them more confident and becoming more positive towards the work that you do. And also, I remember I'm the person who always highlights on communication skills, especially talking in English, which we Indians little find harder to talk in English because we are so clinging to our language, which is not very much essential being in the UK. We have to understand we have moved to the country where English is their first language and we know their culture, and it is our prime duty to respect wherever we go. We need to respect the culture of that country. How do we respect? We respect the culture of the country by speaking English, which I did not find with my colleagues who moved from India to the UK. And it was very hard to let them getting reminded, saying that, come on, you are in UK, let's talk English. It was very hard because people sometimes so much immersed in their own beliefs or in their own thoughts where they pay less attention to something else. Anyway, I always believe what you give, that you receive. And what you put, the effect is seen at the same time or later. So, as I mentioned to you, as a career development, I worked for 1 year as an education practice educator. Then I said, no, I want to move little further to go to the managerial level, where I want to see what is management, because I have been into the practice of nursing for 25 years. So I can see the newly graduated nurses in the UK, they climb the ladder very quickly, and having all the potentials and the adequate knowledge, why don't I move forward? That was my determination. Then I gave the interview for the junior sister, that is a junior manager, where I have to manage many people with a different cadre. It could be I have to have an interaction with the consultants, junior doctors, senior nurses, clinical nurse specialists, junior nurses, band 5, that is staff nurses, healthcare support workers, porters, and the admin team, which I really love that job. I have been into this post for 2 years. Apart from this being a manager in the unit, I also take up extra things. That means I do the individual clinics, which many of you may be thriving for it and may be wanting to do something special rather than only the bedside nursing. What do I do in the clinic? My clinic is called Methotrexate Support Clinic, where doctors have consultation with the people who have got early arthritis, or we say early inflammatory arthritis. Those could be the young people from the age of 23 till the age of 80. People get diagnosed, where we start them with the disease modifying rheumatoid drugs. That is, one is methotrexate, which is very commonly used in cancer treatment in a large dose, but we use it in a small dose in rheumatology, which will relieve your inflammation, thus reducing your pain. What I have to do is they have a consultation first time with the consultant. Then the consultant will guide them towards us, that is me and my colleagues, where we sit with them for 1 hour. We go through what are the effects of medication, what are the side effects of medication, how do you take medication, when you have to report the side effects, what will be the side effects, and what you have to do and what you not to do. And we explain them, we demonstrate them the technique of giving injection, we give them the prescription given by the doctor, we provide the medications, and also we do the follow-up to look how they are with the new medication, whether they are working on them or we need to switch them to something else. I really do enjoy this clinic, which is very, very interesting because you got 1:1 interaction with the people. And when you are very, very knowledgeable and if you are able to communicate in their language, that is what I mean, English, and people appreciate the way you talk to them and people understand what you talk to them, and it is very beneficial to them. So, my dear friends, I would say start talking English today onwards. I will tell you what you study, what you do, what you practice. It will not be waste. It will be handy when you take up the role. That is what I have done because I am not born as a English lady, but I can talk as same as the English people can do it, and my patient can understand what I talk. Secondly, that is the one thing what I do, and the secondly is what I do is the helpline. You might have heard the helpline, suicide helpline in India, where people feel very depressed, people want to end their life, they got suicidal thoughts, where I was a member of that suicidal helpline in India, where we call those people, we talk to them hours and hours, and we switch their thoughts from the suicide to something more effective. Thus, the temptation what they had to end their life is vanished. So the same thing happens helpline here because NHS is very busy. We are short staffed and the people are backlog, what means the line of people waiting to get a treatment is huge. So what we do as nurses is we take up the calls and we talk to the people, we return the call, we get the information from the patient, what they're suffering from, what is their worries, what is their question, and we give them the solution, we give them the answer, and also we will make sure if they need to be seen, we book them for the appointment. That is what we do in helpline, which I do enjoy. We do it from Monday to Friday, which is very interesting as well, rather than only doing the bedside. Also now, because I'm very enthusiastic, you will be knowing me if I keep continuously talking to you, because my interest, my energy doesn't subside, doesn't fade. Even the time passes, my energy doesn't fade away because I'm very energetic, very enthusiastic, and very influential, and I want to influence you all to become what you want to become. Talk to yourself positively because what you talk, that you become. Remember this, what you talk, that you become. So try to boost yourself, your self-esteem with the positivity, and you will become very positive person. Now again, I'm doing the extra training, that is ultrasound guided cannulation, where people are difficult to cannulate. You cannot see their veins, they are dehydrated, they are having chronic conditions where their veins have been collapsed. So you use your ultrasound machine to look for the vein, and with the ultrasound guided technique, you insert the cannula, which is very, very interesting, and it is a new thing that I'm learning and I'm enjoying. This is what I say, that's the career progression. This is what we say, career development. This is what I want to give today. So the takeaway point from this session is talk in English, dream where you want to be, and speak positive to yourself. You will reach where you want. As I said in the beginning, we have got two announcements. The first announcement is that we have completed the first edition of ebook, OET ebook, and we are working on the second edition, which is very interesting and it is a good progress. Second thing, there will be a launching of IELTS course. It will be opened on March 20th at 4:30 p.m. That is the Indian time. But if I say the UK time, it will be, okay, that is maybe 4:30, you come back for 5 hours back. That is maybe 11 o'clock, 11 a.m. in the morning UK timing. That will be the launching of IELTS new course. And also, I'm very proud to say we have been expanding EduSkill international group members. We got 32 countries involved in this, and we got YouTube subscribers, that is almost around 59,000, which is really amazing. And also we have got almost 35,000, 36,000 members in the EduSkill International, where we come together, we discuss, we get effective training, and we get all sort of things. We are privileged to have Father Salim Joseph as a mentor who is passionate about what is he doing and is an influential person. I have taken some of the skills from Father Salim, and I am tireless with my thing what I want to give it to the EduSkill. If you like me to come regularly to your channel, I will make my time to visit you. So by this, I say goodbye. Have a good luck. Hope to see you very soon in the UK. Don't get disappointed. Don't give up. Try your best. Keep positive. Talk English. Let us shine together. Jai India. Bye.